Hi, Dr. Wigoda.
Hey, how are you?
Great. So there's a show on E! Called Bridalplasty. What do you think about it?
I really haven't seen much of the show. I actually watched it for a few minutes. It's interesting because there are a lot of patients that will come in before a wedding, either the bride and groom or the mother of the bride, somebody in the family, or somebody just attending that wants to look good for the event and will come in for some procedure. And sometimes it's a surgical procedure, sometimes it's just Botox and a filler, that sort of thing. So it's not a completely crazy idea for a bride to want to look better for her big day. Obviously, competing with other women to get plastic surgery is done for entertainment purposes and isn't something we would normally do on a regular basis. But kind of in the real world, it's not unusual for patients to come in before any really big event that they want to try to look better. Generally speaking, if they're going to have surgery, I would recommend doing it many months before the event and not coming in at the last minute, because there's a recovery period. There's obviously can be some pain, some bruising, some swelling, and if there's a complication, obviously you want to have time to treat that. So if you're going to have a surgical procedure, especially on the face, I would say at least 3 months before any sort of big event. And if you're going to have a smaller procedure like Botox or a filler, I have patients coming in a day or two before an event, and I hate when they do that because sometimes you get a nice big bruise and you can't really conceal it all the time with makeup. So I would recommend at least a week, if not a few weeks, before an event. And sometimes it's just a dinner party, they just want to look a little bit better, and so they just think, oh, I'll just go in at the last minute. But really it's better, if you can, to prepare and do it a few weeks beforehand.